Chapter 18, Policy Management and Regulatory Compliance. This chapter will cover some of the major federal requirements and regulations that currently govern the medical imaging world, especially regulations that the imaging informatics professional needs to know for his or her job. As we all know, HIPAA is probably the most important set of standards we need to live by as a working professional in the imaging world. Along with requiring that health information be kept confidential, it also requires the establishment of national standards of management of protected health information. HIPAA is comprised of 5 main titles or sections. They are Health Information Reform, Administrative Simplifications, Tax-Related Health Divisions, Application and Enforcement of Group Health Plan Requirements, and Revenue Offsets. We will be diving into Title II a little bit in this chapter, which is Administrative Simplifications. Title II protects against medical fraud and abuse by increasing efficiency and effectiveness of the healthcare delivery network by establishing requirements addressing the management of electronic health information. And right here, this is just a simple flow chart regarding the different titles, 1, 2, 3, 4, and 5. And then in Title II, the administration specifications, there are different rules that we will be discussing. And from the security rule, there are the administrative, physical, and the technical sides, which we will get into. It is required that the Department of Health and Human Services sets national standards for the administrative specifications, and they set down 5 rules, which are privacy, transactions and code sets, security, unique identifiers, and enforcement. Both privacy and security rules have the largest impact on imaging informatics professionals. The privacy rules set national standards on the use, disclosure, and protection of health information. It says that any organization that transmits protective health information is covered under this umbrella, meaning that even business associates that aren't a healthcare facility but still may be involved in the business processes, they are still having to abide by these rules. These business associates who have access to protected health information are required to sign a written contract regarding the protection of electronic protected health information. The security rule was developed a few years after the privacy rule and set standards for the management of EPHI in electronic format, including confidentiality, integrity, and availability. It identified 3 safeguards for compliance, including the administrative, physical, and the technical safeguards. The administrative safeguards are especially important as they include security management and assignment of security responsibility, risk analysis and management, and security awareness and training. The next slide will cover the security safeguards in depth a little more. The HIPAA compliance officer, they develop and implement security policies and procedures for your facility. There also may be a privacy officer and a security officer, depending on the size of the facility. All personnel should know who the compliance officer is for their organization and know how to get in contact with them easily. Security awareness and training should be required for all personnel working with protected health information. Establishing an annual competency is a good idea to ensure everyone is updated on what they should know and also how they should handle situations where a security breach has occurred. Physical safeguards include facility access controls and security plan, workstation use and security, device media control, and data backup. So are your servers located in a secure environment where no one can tamper with them? Are rooms that hold devices that hold important information limited to certain personnel? And are they locked? Is the room temperature controlled? Are the servers protected from electrical surges and outages? These are all questions that you need to ask yourself regarding physical safeguards. Physical safeguards document how the physical access to protected health information is limited, yet still allowing access and use to the proper personnel. You should document how physical access is limited to a system or applications, including servers, workstations, and applications. It is important to implement physical safeguards to decrease the chance that someone who isn't supposed to view the protected health information goes ahead and views it. Make sure monitors are faced away from high traffic areas, and also implement the use of password protected screensavers. Technical safeguards include unique user identification, user account administration, emergency access procedures, audit controls, electronic data integrity, and transmission security. Each user that has access to any protected health information should have a unique user identifier assigned to them. This provides a tracking method to see which users access what protected health information, and it leaves a trail of everything each user accessed. Automatic log-offs should be utilized. They terminate a user's session after a certain period of inactivity with that session. The imaging informatics professional or whoever is placed in charge of this can set the time period for a certain amount of time, but the time should be documented in a policy and procedure. Audit controls describe the procedure for recording and examining the system and application activity. Be sure to inform and remind employees of your facility's auditing procedures on a routine basis, such as an annual review. Electronic data integrity is another component of technical safeguards, and it includes establishing safeguards that protect against the improper modification and destruction of protected health information. Transmission security includes integrity controls and the encryption of data exchanged between two remote locations. I want to talk briefly about MQSA, or the Mammography Quality Standards Act. It is regulated by the Food and Drug Administration. The MQSA establishes national standards for film and digital mammography. The goal is that all women should have access to quality mammograms for detection of breast cancer in the earliest and the most treatable stages. MQSA requires that each facility providing mammograms be accredited. The accreditation performed by the accrediting body is approved by the FDA. All facilities first must be accredited, and then they are eligible for MQSA certification. It also requires that facilities be certified and annually reviewed. Inspections are performed on an annual basis by the certifying agency. Random on-site visits can also be performed by the accrediting body, as well as random clinical reviews. The book goes into much further detail regarding MQSA, so please take some time to review pages 291 to 297 to read into detail regarding MQSA and digital mammography in general. So if you ever find yourself becoming an imaging informatics professional, you have the ability to get certified. This just shows employers that the IIPs have the skill sets they need to be successful in imaging informatics. There are several organizations that offer certificate programs for imaging informatics professionals. We will discuss the tests offered by the American Board of Imaging Informatics as just one example of how certification programs are certified. This board established a national standard of competency for demonstrating knowledge in imaging informatics. So they were founded by the Society for Imaging Informatics in Medicine, in which you can see their logo on the top right of the book as an agency that is associated with the book. And they are also founded by the American Registry for Radiologic Technologists, so ARRT. The Certified Imaging Informatics Professional is the title to a professional who gets certified after they pass their test, so the CIIP. The certification is valid for 5 years, and then a re-exam is required after this time period has elapsed. Eligibility to take the exam is actually dependent on a point system, which means that not everyone is automatically eligible to sit for the test. Applicants come from different backgrounds, including IT professionals and radiology technologists. An individual who wants to take the test has to have a minimum of 2 years in healthcare imaging or imaging informatics. They must have a minimum of 60 educational credit hours or an associate's degree to sit for the test. And then also they have to have 7 points total required to sit for the test. I'm just going to go into the point system a little bit briefly. You can be credited 1 point for every 12 months of work experience in healthcare imaging or imaging informatics. Additional points for your level of education are added. So 2 points for an associate's degree, 4 points for a bachelor's degree, and a graduate degree is worth 5 points. The maximum number you can count towards the 7 points for education is the 5 points. If you have your IT or clinical credentials from an ABII approved organization, you are awarded 1 point each, up to a maximum of 2 points. Continuing education credits in imaging informatics are awarded 1 point per 18 hours of continuing ed credit, but the credits must have been completed in the 18-month period prior to the exam application date, so there is a catch there. And also the max number of points allowed for CE credits is 2 points.